Hi everyone, Dr. Ahmed again. So today's topic is how to treat warts. And I'm referring to the kind of warts that you get on your hands and your feet. They're sometimes also called verrucas. This is a really common problem and I see it both in adults and in children. So the first thing to say is that you could do nothing. So most warts will clear within about 6 months to 3 years. So if you wanted to, you don't actually have to treat them. If you do want rid of them, there's a few options. You can have cryotherapy, which is using liquid nitrogen to burn them off. The main reason that I find sometimes this doesn't work is that patients come with warts that are really thick and hard and have a lot of dead skin over the top. So if you are going to go get cryotherapy done, make sure that you file them down first before seeing the GP. The other reason I find sometimes it fails is because patients don't come back after 2 weeks or so for their second treatment. Many warts verrucas need 2 or 3 treatments, so bear that in mind. Your other option are to use acids like salicylic acid, which you find in wart preparations that you buy over the counter from the chemist. The main reason I find that these don't work is that, again, either people are applying it to dead skin or they're applying it on top of the old cream that's dried. So make sure between treatments you always file off the dead skin and the old cream. The other reason I find it doesn't work sometimes is because people aren't patient. You really need to be using it a few times every week for at least 6 weeks before you start to see a big difference. That's for the average sized wart. The other options are taping. So we're not really sure why, but if you use electrical tape, cut a small piece and cover it over the verruca or the wart and change it a few times a week. Again, after about 6 weeks to 3 months, you're likely to see it improve significantly. And those 3 are the main treatments for warts. Rarely, if you've got a really big, deep verruca that's not responded to cryotherapy or to using acids or taping, sometimes the doctor does actually have to surgically scoop it out. That's called curettage. So I hope now you've got a better idea about how to treat warts. And if I've done it correctly, at the bottom of this, you should see a link that you can click on for more information. Cheers, bye.